Montel Williams, multiple sclerosis, and opioid addiction. I want to read you this very interesting article based on an interview Montel Williams had with Sean Hannity from Fox News. So Montel Williams is a well-known American actor and talk show host who also has MS. And he has a very interesting background. Formerly a U.S. Navy veteran, he actually worked for the Navy in negotiating with foreign countries to try to return U.S. prisoners of war, and perhaps that's how he became comfortable having very difficult conversations and essentially indirectly got his start as a talk show host. He's most well known for the Montel Williams Show, and he has a very serious professional style in contrast to other shows like the Jerry Springer Show, and I think that garnered him a lot of respect in the industry. He was just very good at having these difficult conversations with vulnerable people and really showing their humanity. Anyway, he retrospectively reports that he's probably had symptoms of MS since around 1980 when he was still in the U.S. Naval Academy, and he had symptoms of vision loss in the left eye, and his vision was only 20/300, but slowly improved over time. He had some other symptoms like numbness in parts of the torso and legs, and also trigeminal neuralgia, which is a facial pain syndrome which is associated with MS. He later had burning pain in the legs, which retrospectively was neuropathic pain. This is when the legs are normal, but they're sending information, say, through a damaged area of the spinal cord because it's demyelinated due to injury from multiple sclerosis, and by the time it gets to the brain, it's interpreted as pain. And these symptoms are all very well known to be associated with MS. When I listen to his history and other interviews, it's highly typical of MS, but he wasn't diagnosed, he says, because he's a black man. Now, women are more likely to have MS than men by about 2-to-1 or 3-to-1, and it's historically thought that Europeans are more likely to get MS, but that's not really true. We found in Southern California that black and white people have roughly equal rates of multiple sclerosis, though some ethnicities like Asians and Native Americans and First Canadians may actually have a lower risk. But at the time, a black man was thought to be unlikely to get MS, and so you can't necessarily blame the clinicians at that time. Also in 1980, MRI wasn't readily available, and the diagnostic criteria have changed over time such that a single episode, such as optic neuritis, wouldn't necessarily make someone fulfill the diagnostic criteria for MS, but retrospectively, he probably obviously had MS for almost 20 years until he was formally diagnosed in 1999. Born in 1956, he's now 68 years old and actually had a second medical problem, a hemorrhagic stroke or bleeding of the brain, in 2018. It occurred in the cerebellum, an area of the brain involved in coordination of fine movements. In one video of Montel walking, he appears to have slight weakness of the left leg and has difficulty lifting the leg and using those hip flexor muscles, and also circumducts or rotates the leg slightly in order to walk, though he looks healthy and fit and is doing reasonably well. But one of his main symptoms over the years was severe, intractable neuropathic pain, and he also suffered from significant depression and even attempted suicide twice, according to one of his books. He reportedly avidly researched MS and treats it with standard Western treatments, though I can't find a source that says he does or does not take disease-modifying therapy or standard medication for MS. He is a proponent of medical marijuana and herbal treatments and keeps a strict diet and exercise routine. So let's move to this article, which I think is very enlightening. It's written by Emily Ann Jackman, and it's about an interview with Sean Hannity. Discussing a painful ailment is never an easy thing to do, but former television host Montel Williams recently opened up about his battle against MS and the pain and issues that come with it. During an interview with Sean Hannity on Fox Nation, Williams talked about the blunt warning he received from his doctor way back in 1999. He looked me in the face in his office and said, "You know the type of MS you're in. When it hits people of your race, it normally is really very debilitating, said Williams. Now, this is something I personally would never say to a patient because MS is highly variable from person to person, and it's almost impossible to predict the prognosis in an individual person. Also, the statement is simply not true. For instance, yes, some studies have found that men are on average more likely to have greater disability than women, but it's not a huge difference. For instance, this study on progressive MS found that men were 17% more likely to have progression. Again, not a huge difference. Also, even if this doctor thought that he had progressive MS, presumably he could have had secondary progressive MS because he has a clear history of relapses such as optic neuritis going back to as early as 1980, and maybe at the time he saw this other doctor in 1999, he was reported a slow worsening of symptoms. But if you look at this study from the MS EPIC study, University of California, San Francisco, on progressive MS, a significant minority of people followed over 10 years, represented in the light gray, were actually stable or even improved. So not everyone with progressive MS actually gets worse over time. People can be stable, have plateaus, or rarely even have significant improvement. I do have some patients with progressive MS who have had significant reversal of disability. It's not common, but it can occur. Also, there are some studies suggesting black people with MS have a little bit more disability on average, but it's not necessarily an intrinsic biological effect. It could be due to something else, like a bias in black people being diagnosed later, a so-called lead time bias. And this is really not actionable information, and I certainly have black male patients with MS who are doing quite well and have been stable for many years, and it could be very psychologically damaging to tell this to a patient, and there's really no reason to do so unless they ask you and you're absolutely certain, and again, there's simply no way you could be. But let's continue with the article. This was during the time Williams hosted the Montel Williams show that ran from 1991 to 2008. So essentially, the peak of his career is when he got formally diagnosed with MS. He said, you're probably going to be in a wheelchair in 5 years, so you need to get your expletive together. Again, there's absolutely no medical basis or no evidence suggesting that this is an appropriate thing to tell a patient, and I assure you that was also true in 1999. Multiple sclerosis is a chronic autoimmune disease which affects the central nervous system, impacting the brain, spinal cord, and optic nerves. Unfortunately, there is no cure for the disease, but there are treatments to help those who suffer cope with their pain. Hearing this left Williams speechless. It was a terrifying time for the public figure because at the time, experts believed MS only happened to white individuals of European descent, and I can say that's simply not true. In 1999, it was well known that MS can affect various ethnicities, though it was thought to be more common in white people. I didn't think I could get MS, Williams admitted. Now, the National MS Society acknowledges that the debilitating condition does affect the black community, and what's worse is they face a more aggressive progression of the disease. To my knowledge, the National MS Society has never explicitly denied that MS can occur in black people, though in the past it was widely thought to be more common in people of European descent, as I said. The talk show legend was diagnosed by a specialist after he experienced an intense amount of pain in his feet and legs following a flight. To get a better idea of what Williams felt, he recalled, it was like you took a hot fire poker, shoved it right up to my heel into my shins, and it was there 24 hours a day. Looking back, Williams realized he overlooked some earlier symptoms, which was around the time he graduated from the Naval Academy 10 years before. After being diagnosed, Williams was told by doctors to slow down and take a break from his heavy career schedule in television. Now, I want to say that although many people with MS report a worsening of symptoms during periods of stress, there's no actual evidence that making a change in your career to make it lighter or easier will actually positively affect the prognosis of MS. In other words, there's no specific medical reason someone with MS cannot work a high-powered career, though everyone has different results. And yes, some people with MS, they don't do well if they're working 80 hours a week, and you just have to figure that out for yourself. When I got off the plane, my friend, who was a doctor, sent me to another doctor, and that doctor told my ex-wife, "Your husband's got MS." Now, this reads a little weird. Did they not tell him directly as though he wasn't a human or something like that? It's a little bit strange. He said, "Yeah, I think you need to stop doing this heavy activity." He said, "All those things are too stressful for you. And stop the weightlifting. And you need to stop your show because there's too much anxiety in that, and it's probably stressing you out too much." Now, there's actually a lot of evidence that even though many people with MS could experience a temporary worsening of symptoms with exercise, exercise is actually good for MS in the long run. So it wasn't necessarily good advice to tell him to stop exercising. And as I said, my view, if he had asked me, would be there's absolutely no evidence whatsoever that stopping your talk show will have any benefit to your prognosis of MS whatsoever. So if you want to keep doing it and you're able to keep doing it, you certainly can. But instead of listening to doctors' orders, Williams pushed forward and tried to live with the pain. But the pain only worsened, which caused Williams to turn to prescription opioids. So I give Montel a ton of credit. Despite suffering the potentially debilitating diagnosis, having intense pain, being told by doctors to stop the show, he wanted to continue. He wanted to live his life and do what he wanted to do. But unfortunately, he started taking opioids. Now, a lot of people view the use of opioids as some kind of moral weakness. And what they don't realize is dependence on opioids is actually a neurophysiologic phenomenon. For instance, many people experience tolerance or reduced benefit of the medication with chronic use. And what might be happening at the neurophysiologic level is that when you take this opioid over and over again, you get less of the opioid receptor or the mu receptor, or the downstream effects of that receptor are downregulated. So you're actually changing your brain. So it's not some kind of moral weakness causing people to get addiction. That's just one of the properties of the drug. And it was of great variety Williams was taking, where he used his celebrity status to get his hands on the pills he wanted. I saw Montel comment in another interview that doctors were basically willing to give him whatever he wanted because, he was rich and famous and they wanted to appease him. "I was on Vicodin, I took Percocets, any one of the sets I took," he admitted. But his opioid usage caused the well-known television host to spiral out of control for almost 2 years. For 6 months during this heavy cycle, to Williams, he was an addict. It was about a 6-month period of time where I know I was addicted because I wouldn't walk out the door without throwing 4 of them in my mouth at the beginning of the day. Another 4 about 2 hours later, another 4 about 2 hours later, he admitted to Hannity. There was even a time when Williams was using a morphine drip. Morphine would be a more powerful opioid compared to, say, Percocet or Vicodin. But it wasn't until a doctor got involved when he began to kick the controlling addiction. And in another interview, he actually describes that a doctor found out that he was sort of doctor shopping and getting prescriptions from different doctors and actually cut him off. It's generally considered to be unethical to prescribe opioids to someone who's getting it from multiple doctors because there's no way to monitor how much they're taking, and someone could easily accidentally overdose and potentially die. The more I took, the less they worked, and that's something we know for a fact, Williams explained. Science knows that these opioids were never created for long-term use. When Williams had finally beat his addiction, the former show host looked for healthier means to manage his condition. Williams says his vegan diet, which helps to reduce inflammation, and CBD, which helps relieve pain, greatly played a significant role. But mostly, Williams credits the change he made within himself was what made all the difference. I went on a vegetarian diet for about 5 years. I didn't do anything but liquid food. The biggest nemesis of MS is inflammation, so I wanted to reduce the inflammation. Once I learned how to reduce inflammation, that started mitigating a little bit of pain, he explained. So there is some basis to this. From an epidemiologic standpoint, the rate of MS MS is higher in countries where there's higher dairy consumption and higher saturated fat consumption. It was Dr. Roy Swank who initially reported this in Norway, where inland areas where people consume more beef and dairy, there were higher rates of MS compared to coastal areas where people ate less. And there are subsequent studies, for instance, in a whole foods plant-based study, a study done at Oregon Health Sciences University with Dr. John McDougall, finding that a vegan whole foods diet did reduce fatigue in people with MS. And there's some popular diets such as overcoming multiple sclerosis and the best bet diet, which are also relatively low saturated fat. However, this diet is not definitively proven, and there are other diets such as the Terry Wahls diet, a paleo type diet that can be quite high in meat and saturated fat, and actually also has randomized trial evidence. So there's not a single proven diet for MS, in my opinion. Then I started learning some things of how to literally psychologically grab it, put it in a box, stick it away, as long as I keep it in that box, he said. As long as William does that, he's able to cope with the disease even though the pain does come back. Now, I think many people with chronic pain would take offense to this, the implication that it could be partly psychological. However, I've talked to some pain management experts and some patients dealing with chronic pain, and some people have actually reported significant success with things like cognitive behavioral therapy and stress management. Not necessarily that the pain is not real and legitimate, or not necessarily that it would cure it completely, but maybe people would be able to better manage it and take less medications. Typically, pain in multiple sclerosis, in addition to trigeminal neuralgia, are best treated with neuropathic pain treatments. There are some alternative options, such as the nutritional supplement alpha-lipoic acid and benfotiamine, and acupuncture, along with prescription medications such as gabapentin, or in the case of trigeminal neuralgia, carbamazepine and oxcarbazepine. So typically, we try to avoid opioids if possible because of the potential dependence and other side effects like constipation. And Montel also reports that he did have significant constipation from opioids. So I think Montel is awesome. He's a fighter. He's gone through so much in his life, but he continues to fight in order to thrive, to live the type of life he wants to live. And he reminds us that no one is immune to having problems in life and opioid addiction. If you've ever experienced problems with opioids, please share your experience in the comments below, or if there's anything else relevant you'd like to say. And I'll end with this. Montel reminded me of this book, the Berenstein Bears book, Trouble at School. And in this book, Brother Bear makes a series of bad decisions. He doesn't do his homework and he ditches school, and he runs into his grandfather, who gives him some life advice, and his grandfather explains it with an analogy. So his grandfather explains that he lost this wagon in a lake, and Brother asks him how he lost it, and he said, "It happened a long time ago when I took a wrong turn, just the way you did when you didn't study that schoolwork that Teacher Bob sent home. Well, instead of admitting my mistake and backing up, I just pushed ahead until I was in so deep there was no getting out." "And you lost the wagon?" said Brother. "Yep," said Gramps. "But I learned a valuable lesson. If you find yourself on the wrong road, don't just keep going until you're in over your head. Back up and start over on the right road." And that's what Montel did. He backed up and started over on the right road, and look at him now.